I am Brito FCAP vestibular physiotherapist, and today we're going to be talking about the sitting rising test, otherwise known as the SRT. So the SRT is a simple functional screening tool that was invented by Dr. Araujo, and it evaluates a person's non-aerobic physical fitness through their ability to sit and rise from the floor. All you need to perform this test is a flat, firm surface that's 2 meters by 2 meters. You want to be barefoot to maximize the grip from your feet, and you want to be wearing some comfortable clothing. That way you're not causing any restrictions in your movements. So without worrying about the speed of movement, try and sit and then rise from the floor using the least amount of support that you feel is needed. A person's ability to sit and rise from the floor is measured according to the number of supports needed to perform each of the movements and their level of stability transitioning through these positions. So everyone starts off with a score of 10. When transitioning from standing to sitting, you score anywhere between a 0, which is your minimum, and 5, which is your maximum. And as you transition back to standing, you are scored again from 0 to 5. To perform the movements, you may cross your legs. Starting from a score of 5, 1 point is subtracted for each support used, for each hand, forearm, knee, and side of the leg, and as well placing your hands on your thighs when rising. You also lose a point, and also if you're found to be wobbly or you lose your balance, you also lose half a point there. So 2019 study by Dr. Araujo and colleagues followed 6,141 men and women for 20 years. And they found that a score of 10 in the SRT was most common in men aged 16 to 25 and in women aged 16 to 40. They found, interestingly enough, that less than 8% of men and women greater than 55 years old were able to achieve a score of 10 on the SRT. Another 2014 study by Brito and colleagues followed 2002 men and women aged 51 and 80 years old over the span of 6 years. No subjects greater than 70 years old scored 10 on the SRT. The study revealed that those who scored between an 8 and a 10 had a low risk of death during the 6-year tracking period. The subjects who scored between a 3.5 and an 8 were 2 times more likely to die within the 6 years, and subjects who scored a 3 and under on the SRT were 5 times more likely to die within the next 6 years. The subjects in the lowest score category had a 3-year shorter life expectancy compared to the subjects with the best score. An optimistic point, though, to acknowledge about the study was that it noted that a 1 point increase in the SRT score demonstrated a 21% reduction in all-cause mortality. So here I go. Here's a sitting rising test. Don't want to be using my hands, elbows, knees, or side of the thigh or leg. So the sitting rising test was designed to evaluate non-aerobic physical fitness, but it's if safely administered, it can also be used as a great tool for our dizziness population. Dizziness can impact both genders, all ages, and it doesn't discriminate with body mass index either. So it would be a reasonable screening tool to consider. It is a great outcome measure to show a patient their own progress from initial examination to discharge on how they have improved with respect to muscle strength, balance, joint coordination, and flexibility. As well, it may be a valid screening tool to perform upon discharge. If balance deficits are severe, the SRT evaluation may need to be delayed or just not done at all. And if you have bad knees or hips, just don't do the SRT test. It's not appropriate for you. Have a friend or family member standing close by just in case, and stay clear from any furniture with pointy edges that can cause injury. So according to a 2004 study, Bergland and Wyller showed that the strongest predictor of serious fall-related injury was the inability to rise from the floor. And in a separate study, Tinetti and colleagues showed that there is a strong relationship between dizziness and the risk of falling, especially in the older populations. So if an individual is suffering from a vestibular disorder and they've been sedentary due to dizziness, vertigo, disequilibrium, or even imbalance for any prolonged period of time, they're going to have quite a substantial degree of musculoskeletal deconditioning. And when you add this factor to a person's lifestyle, that is potentially their sedentary nature due to their job description if they're an office worker, that's going to magnify the potential risk for falls when dealing with any dizzy spells. So once again, I'm Peter Taloniadis, FCAM vestibular physiotherapist from the dizziness class, and today's topic was the sitting rising test. Thank you.